Welcome to the Pain Science Education Podcast, where we discuss ways to treat and reverse persistent pain. I'm your host, Dr. Joe Tatta, a licensed physical therapist and founder of the Integrative Pain Science Institute, where we train practitioners on whole person pain care. This podcast also serves as a public health campaign to support those living with chronic pain. This podcast is for informational purposes only and is not intended to be a substitute for professional medical advice. Hello, and welcome back to this week's episode of the podcast. Today, we're diving into a fascinating and often overlooked connection between anxiety, dizziness, and pain. Joining me is vestibular physical therapist Sarah Conover, who brings a wealth of expertise on how the vestibular system interacts with both the body and the mind. In this episode, we'll explore how disturbances in the vestibular system don't just cause dizziness, but can also activate the autonomic nervous system and trigger anxiety. We'll look at shared pathways involving the amygdala, hypothalamus, and other brain regions that help explain why dizziness and pain so often overlap with emotional distress. Sarah also explains why a truly holistic approach, one that integrates physical therapy along with mindfulness and other health behaviors, can be so powerful in helping patients regain stability, reduce anxiety, and improve their quality of life. If you'd like to learn more about Sarah's work, visit her online at dizzycoach.com. Okay, without further ado, let's begin and let's explore the connection between anxiety, dizziness, and pain. Hi there, Sarah. Thanks for joining me today to talk about mental health and dizziness.
Hi, Joe. It's great to be here. Yeah. Thank you for inviting me.
You're welcome. I've been wanting to speak to you because you have a very illustrious career of working with these two conditions over the course of many years. And you and I were talking before we hit record here today just about your background and your history. And one of the things I really appreciate about your background particularly is that your career started out as a neurologic physical therapist, which makes perfect sense regarding the connections of dizziness and mental health. And I love that too, because you also work somewhat, as we all do, in the pain space. And I really feel that as physical therapists, oftentimes pain is kind of embedded within orthopedics, where really, since it's a nervous system based condition, it kind of really, maybe we should put it more in the neuro section of our academies and learning objectives. But tell me how you started out and the trajectory of kind of where you've arrived today.
Yeah. Well, thank you for your kind words. Illustrious career means I've just been around a while. I graduated in the late 80s with my PT degree. That was way before the DPT. I went out and I've always loved the brain. I loved studying psychology. I loved studying the connections in the brain. I loved my neuro clinicals really a whole lot. And so I worked at that time, our hospitals were huge. We did a lot longer acute care. I worked in the neurological intensive care unit. So I did acute neuro pretty much every day in Norfolk, Virginia. And from there, when we came back to the Midwest, and from there I went into acute rehab. I spent a lot of time in acute rehab, and it was during that time that I started getting really interested in balance. And so I took my first continuing ed course on vestibular issues, because when I was in school, it was basically, this is the balance system. It was, not very involved at all. And that course was taught in Chicago by Dr. Timothy Hayne, who is one of our gurus we really look up to here in the vestibular world. And I got hooked. So at that time, I was just sort of talking to my colleagues and teaching that there is something to do about this. And at that time, we weren't getting many referrals for, primary care physicians were not, didn't know there was anything to do about this, and nor did a lot of ENTs. So it was sort of just a lot of educating. And I built my practice up. Um, by the time I was trying to think about this as I was preparing. It was probably the early mid 2000s, maybe between 2005, 2010, where I was pretty much full time working with people with vestibular issues. And now I own my private practice. I'm the only clinician, and I see primarily very chronic vestibular issues. Um, I I see the random acute BPPV, but mostly I do telehealth. I do mobile outpatient and telehealth. My practice is in Ohio. I do coaching as well. I'm a certified health coach, and so I do have some clients outside of Ohio that is strictly coaching. So that's in a nutshell.
Tell us
And
some
I've
of,
had to, I ran into, I came acquainted with Joe because of your fabulous work. I think I got my certification in health coaching, and then I also was really delving into lifestyle medicine. So I took your nutrition course, and then I to put together dizziness and mental health, one needs to go a lot to the pain science
mm,
because they are similar. Pain and mental health are similar to dizziness and mental health, but there's not nearly as much written about it yet. Um, and so I've gotten so many great resources and help and understanding by the work that you do, Dr. Tatta. Thank you so much.
you're very welcome. I appreciate you having your pain and mental health is similar to dizziness and mental health. And I want to unpack both of those as we move throughout this episode. Um, Positive lifestyle factors are important. Obviously, as a health coach, you know that better than perhaps most of us do at this point, I would say. As you're talking, I'm just, I think, so I want to shed light because it's really interesting to me. Well, as you're talking, I'm thinking about the evolution of pelvic health in physical therapy. Because right around the same time, in probably the 80s, 90s, pelvic health as a specialty started to kind of arise. At the same time, vestibular started to arise. And I don't think many people are really aware that there was a long period of time where people had these quote unquote symptoms, right? These undiagnosed, unrecognized symptoms. And in your case, people just called it a balance problem or a dizziness problem. And people just lived with these things. They had no treatment, or they had very little, or what we might say low efficacious treatment that people would receive. Today, what are the names of the conditions that you see in your practice within the vestibular world? Because now we finally have ways to diagnose, identify, and let people know that, hey, this is more than just your balance is off, you're getting old.
Yeah, yeah, that's a great question. So we the diagnoses that I most see, vestibular migraine, that's a clear connection between pain, possible pain, although you can have migraine without having pain. There's all sorts of migraine, visual migraine, hemiparetic migraine, all sorts, and vestibular migraine. Um, 3PD, which is persistent postural perceptual dizziness, which interestingly used to be called chronic subjective dizziness.
Mhm.
And Dr. Staub out at the Mayo Clinic was instrumental in coining that diagnosis of 3PD. But it's always been in the realm of a um, psychologically mediated maybe condition, not purely psychological. And like most things are, we are a whole person. And like you said earlier, the brain and the nervous system infiltrates everything. So, even pelvic health, right?
Mhm.
It's um, we experience pain, we experience dizziness, we experience our sensations in the brain. So important to study that. Mal de Débarquement syndrome is another one that's in that that I see a lot. I see a lot of undiagnosed. It's central dizziness is something that's talked about a lot. Of course, I see acute dizziness as well, but that generally doesn't have as much of the psychological components to it.
And you see things related to other neurologic conditions such as Parkinson's. Is that something that you might see occasionally?
I don't any longer. I used to do a lot of work with Parkinson's and stroke and multiple sclerosis, all of which have, balance
Yeah.
issues. Yeah. Hmm.
So start to make the connections or the associations for us between mental health and dizziness. Let's start with that first.
Yeah. So the anatomically and physiologically, the systems are very connected. So the vestibular system is a very rudimentary system. It's responsible for very basic function, keeping us oriented to where we are in space and keeping us upright along with our systems of vision and proprioceptive somatic sensation. But it's very rudimentary and it's connected very with a lot of prolifically maybe is the word with a lot of our other systems. So it's very much connected with the eyes. There's reflexes that it's very much connected with the neck. It's very much connected with the autonomic nervous system, with the memory. So we have the vestibular nuclei, and then there is a nucleus called the parabrachial nucleus. It relays messages to the insula, which is connected to the hypothalamus, which controls a lot of our autonomic nervous system responses, and then the amygdala is involved in there as well with the memory of those responses, the emotional memory. So it's not unusual for someone to get nausea, fast heart rate, vital signs change, diaphoretic when they have vestibular issues. The autonomic nervous system is very activated. It also is not, you can put side by side the vestibular symptoms and like an anxiety attack or panic attack symptoms, and they look a lot alike.
Mm.
When someone gets nervous, sometimes they get nauseous and sweaty armpits, and same with vestibular issues. So physiologically, there's connections, and then also situationally, there's a relationship because when you're dizzy, you you can hardly do anything else if you're dizzy enough. It takes all your energy to just do basic things when you have dizziness, and that causes anxiety because why wouldn't it? You don't know if it's going to stop. It's not like you just got off a merry-go-round and you're pretty sure it's going to stop. You just don't know. So situationally, it causes a lot of fear, a lot of wondering, a lot of I don't know how long am I going to deal with this? So there's situational anxiety as well.
So in there, you've mentioned a bit of differential diagnosis as well, and I imagine that oftentimes these things are missed or undiagnosed or misdiagnosed in patients. Do you see that a lot in your practice?
Yeah. Yeah. People come at, at lots of different places in their journey. Most of the time I see undiagnosed, um, not really misdiagnosed, unless it's misdiagnosed as anxiety, just pure anxiety. Sometimes what happens initially is there's an initial ear issue, and that heals, that gets better. There's when all the testing is done, it's like, no, it's not your inner ear. And then ear, nose, throat doctor might send the patient to a neurologist, and the neurologist does the scans, and there's nothing, there as far as anything that comes up on diagnostics with an MRI. But between the time that the initial insult to the ear happens and the time I see people, they've gone into this sort of syndrome, right? A lot like chronic pain.
Mhm.
The pain, the source of the pain, the structures look healed, but the brain still experiences the pain. The ear, there's nothing that shows up on tests, so it's like central dizziness, is but really what possibly has happened is that initial insult and then the nervous system takes it a different place.
Right. So the mechanisms in the inner ear at
Mhm.
that point are not responsible for the dizziness.
Possibly not. Possibly not. I see all kinds of things, and it doesn't have to start in the inner ear. It can be a central
Mm.
origin as well. Migraine, stroke, like a cerebellar stroke, MS. I mean, it doesn't have to start in the inner ear for sure.
Mm. And earlier you mentioned, obviously, because you're what I loved earlier, and I'm sure many people caught it as well. You gave us a really nice kind of whole person summary, kind of taking us through the whole body. So you mentioned obviously mechanisms in the inner ear itself. You talked about different brain structures, right? And then kind of moving down, connecting our brain to our body. We
Mhm.
have things like proprioception and position sense, and all that, all the somatic pieces become
Mhm.
affected as well.
Yeah, and that's super important in treatment of the vestibular patient, period. Attention. So when I pick, like, I do a lot of mindfulness work with my clients, and oftentimes, well, I would say it's a rare time that I don't teach them at least several choices of mindfulness practices that are more somatic based, like a
Mm.
body scan, a grounding, um, a breathing, a deep muscle relaxation technique. Those are super helpful in the vestibular anxiety. Yeah.
Grounding just feels good to me. I would imagine grounding just feels good as someone who struggles with dizziness on a persistent basis.
Yeah, oftentimes there's some mismatches in what the brain is perceiving from the eyes, the ears, and the proprioceptive somatic sensations. And so a good example I use a lot for my clients is, that experience where you're sitting in the car and you're at a stoplight and the person next to you moves and you
Mm.
slam on your brakes because you think you have that perception. Your eyes have kind of lied to you, have perceived that motion, and that happens in a much more profound way with our folks, especially with like 3PD, where I tell people your eyes like to be the boss and they're not accurate. They're not accurate. And they're being the boss quite a bit in this 3PD. And so we've got to teach your other systems to teach your brain to recognize your other systems in a little more functional way.
Yeah,
Well,
balancing.
that somatic mindfulness, it does two things. It helps the brain to be aware of the body and all of the information about space and motion. And it also has an effect on the autonomic nervous system to move out of that sympathetic state into a more parasympathetic
Yeah.
state.
And this might be because we're talking about mindfulness, and uh, what I love the way you're framing mindfulness is you're not framing it just as a cognitive process, but you're obviously framing it as a somatic process as well, which is important. A lot of people teach mindfulness just as like the thinking part of the brain, and really
Mm-hmm.
traditional mindfulness brought all those things together as you're describing. To get a little more granular, I'm curious if you have noticed or experienced, if your patients experienced other changes in their interoception in their body because you're bringing them through these mindfulness practices. So, any other changes that they might notice? Because you mentioned that they have a change in heart rate. I imagine they have a change in blood pressure and maybe even respiration. Those things happen.
Yeah, for sure. Now I do a lot of telehealth, so I can't in that situation I can't measure their heart rate, physically, but yeah, um definitely some changes. And also, I mean, I think taking it another step further in the mindfulness of their body, there's also that acceptance. So bring in a little bit of that from ACT, that acceptance and learning how to be curious of the sensations, and have even just a little scooch of acceptance of what that feels like in their body, because we know that that's a big part in moving through the sensation of safety in the presence of those symptoms. Our brain with the brain with dizziness 24/7 feels unsafe.
Mhm.
And so if we can teach the brain just a little bit, like, it's okay because I can sit with this for 30 seconds
Right.
and appreciate it and be curious about it, it brings the nervous system into feeling a little more safe.
Yeah.
And
I
I
love.
did want to mention, I do a lot of thought work and that as
Yeah.
well.
Yeah. I love the acceptance piece. So what I'm hearing from that is bringing a little bit of acceptance in with dizziness gives people space, right? To
Mhm.
be with a little bit of that dizziness rather than the moment they experience dizziness, I'd imagine that they kind of go into that automatic reaction, which would increase their anxiety and other symptoms that they're experiencing.
Absolutely. Absolutely. And it's baby steps.
Yeah.
It's baby steps, because there's nothing that will be more detrimental than increasing, by what we're doing, increasing the fear.
Yeah.
And it just backfires there. So it's we call it microdosing, graded exposure, all kinds of names for
Yeah.
that.
Tell us about other tools that you use. So you mentioned a little bit of mindfulness already, kind of the
Mhm.
acceptance and the awareness piece. You mentioned some
Mhm.
cognitive pieces here. You mentioned some somatic pieces. What are the other
Yeah.
go-tos that you're using as far as tools and techniques and methods in working with this population? Because these are complex conditions, right?
Mhm. Yeah, they are. Um, well, I love all of the tools in ACT. I use cognitive diffusion quite a bit. The concept of, instead of becoming the thought, separating of, I'm having the thought that, um, and with that, once that sort of leads sort of into sort of thought reframing, which is more like CBT, but is that why I'm, being curious about that thought, and looking at what I like to take as my own little thing. I ask a couple questions about thoughts. One, is it true? So when someone says, I'm afraid I'm going to, I wonder if I'm going to be like this forever, if I'll ever get better. What they're really saying is, I think I might be, and I'm afraid I might be. So, that's an example of a thought, a fear thought. I can't do this. I can't go to my daughter's ballet thing, and that's disturbing. That's a thought. So examining the thought and asking, is it true? Is it true? Most of our thoughts are true. Our positive thoughts are negative. We will get rid of an untrue thought pretty easily. So that's usually a yes, but we look at it a little bit closer. Like, is it all the way true? Are there bits of it that are not true, right? Or yet to be determined. They're just worried thoughts. And then, is it serving you? Is it serving you? Because we can have true thoughts that don't serve us very well. And it so then comes the choice of, and that this is a real foundational part of like CBT of what would you rather think? What would you rather think that's true? So working through that. And so I have an anxiety journey myself. I've been anxious most of my life. I had a very rough patch about 20 years ago where I was having daily panic attacks. I mean, I'm very well acquainted with anxiety. And that's probably why I am even more drawn to this because I have been transformed by the tools that I have learned. And journaling, expressive writing, reframing, diffusion, all have been, as well as mindfulness practices, meditation, have all been so critical in my getting to a place where I'm living in the moment and not worrying nearly as much. And that's what I teach. A lot of sometimes I'll bring up journaling or expressive writing, and they'll be just like, nope, that's not going to work for that person, at least not right off the bat, because there's a block to that. So a lot of I use an eclectic approach. Thankfully, with the training that I've had, a good part from Dr. Tatta here, I have a lot of different tools that I can use. And I know you teach Joe a strength-based approach, which is super critical, and that goes along with that thought reframing. You know, if can we not? It's different than just empty affirmations. Way different. It's digging in and focusing on those strengths in a lot of different ways. I love the CPR that you teach of framing. The CPR is oh gosh, curiosity, what compassion, strengths. I'm trying to think. I'm looking aside because I'm thinking here. Um, Character, competency, capacity. P is promise, focusing on promise, purpose. I talk with my clients a lot about their values and what drives them and their purpose, which that goes into spirituality as well. And then our resilience, resolve, resources. Hopefully, I've gotten them for the most part.
And all those align well with the coaching skills that you've brought to your practice as well, right? Because um, people look at coaching as it's just about eating better and sleeping better and moving your body, but there's also a strength-based aspect to health coaching, which is very different than what we learn in traditional physical therapy practice.
hmm Yeah, we're looking for problems and then a solution, a goal and a solution to fix the problems in
Yeah,
traditional PT. Yeah.
yeah. So we have to be able to, and I think what you're beautifully describing in this episode is how on one hand you can embrace that there are deficits and challenges that people have that we can help them resolve, so to speak, right? Resolving impairments, that's part of what we do. But on the other side, we can prop them up with these really more protective factors that we have, things like mindfulness and strength-based approaches. And people need both, right? That's
Mhm.
that's the skill of being someone like Sarah with many decades of experience as you develop these skills of, yeah, I've taken all these courses and all these things, but now I know how to integrate them for the person that's in front of me. So you tag spirituality, which
Yeah.
many PTs don't talk about, right? They talk about purpose and meaning, and I think the word I've like you listen to other podcasts, and people throw out the word meaningful activity all the time, and I'm like, okay, what does that really mean? Uh,
Yeah.
so tell me about the role of spirituality in your practice and working with people because people would say, "What's the connection between being dizzy and my spirituality?"
Yeah, it's part of our wholeness. In PT school, I remember very well being taught you don't talk about three things: politics, money, and religion. And I learned that. I mean, this was back in the 80s. Like those are off limits. And that's still, that's a story that I kind of laugh at now. Though it's wise not to talk about some of those in some ways.
Not in the first session, at least.
Um, but that brings me to like religion. Religion is a lot of people will group religion and spirituality as the same thing, and it's not. Religion is the structure, the organization, the man-made belief structure, okay, which is definitely beneficial and has a place in all of that. Spirituality is the individual need, the quest, the yearning for connection and knowing how they fit in the world and and their purpose. And I believe it's within all of us that we all have that yearning. And so I I talk about it kind of lightheartedly, and I will ask about some questions as I get to know my client. And then I just invite them to share as much and let our talking about it um, go to the depth that they want to go. I want to know. It's not about like what religion they are. It's about where are they in knowing who they are and how are they feeling about their connectedness. That's kind of the base.
Mhm. And do you find is this like, obviously you're feeling this out with your patients, you're getting to know
Mhm.
them. Is this coming up in session one for people or kind of on the later sessions?
It's usually later. It's usually later, but sometimes people will say right off the bat, um, I can't go to church anymore. That's really hard. Or I don't know, I don't have a purpose anymore. I don't know what to do I've lost all like the roles that I thought were giving me meaning. Um, and so we'll delve into that a little bit more earlier. I'm pretty intuitive, so I can read read the desire. And I flat out ask them too. There's nothing like flat out asking, we can have more conversations about this. Is this a topic you're comfortable with? Would you like to talk more about this?
Yeah.
Yeah.
And sometimes when you're using mindfulness-based practices, these things start to arise naturally in conversation. Because mindfulness can, especially if people start becoming really embedded in and start doing it, every day, like we'd like them to do, even just 3 minutes a day, there is a transcendent quality to that. And it does sometimes bring up questions of what am I really experiencing here?
Absolutely. I think also as like, I mean, is it okay if I kind of share personally, like what's okay? Um, so one of the most profound ways that I have been transformed in this work of mindfulness and really separating from my thoughts and looking and being curious of my thoughts. I grew up with a fixed mindset. So if you've read Carol Dweck's work, like I flat out was fixed mindset, and I've had since being familiar with that work, and the being invited to learn how to grow into um, um, a growth mindset. I have just opened up the possibility in my mind of learning more about myself. So with with that work, that cognitive diffusion, that thought reframing, that looking at my beliefs and my stories, and being and learning how to be in the present moment, because when you're anxious, you're worried, and that's future. If you are living, you're living in we live in the moment. You all you're having in the moment is anxious thoughts about if you're thinking about the future. If you're really present, you're really living, you're really in the moment. And and for me, I have become so much more in tune with myself as a spiritual being and my relationship with myself, my creator, has just skyrocketed. It way more than any sort of religious teachings could have
Mm-hmm.
done. So, um,
So this starts to elevate the conversation to because I've like yourself, I'm trying, I attempt, none of us are perfect at this, to look at both sides of the coin, both sides of the story, try to take different and multiple perspectives of things.
mhm,
I'm wondering if your patients, and you experience this, if your patients in some way, because they've had these things for so long and they've gone untreated until they come across someone like you, is if some part of their experience is dissociation.
mhm,
And when you start to bring in these more mindful practices, which border on, the spiritual transcendent piece,
mhm,
is now they start to have these a completely different experience. And I would
mhm,
imagine, because as you mentioned, I have dizziness for 3 years and it's gone untreated, right? Nothing's
mhm,
helped, and I've started to lose some hope.
mhm.
So there's a sense of hopeless there. And because my mind is really focused on survival, the only thing I think about is when is the dizziness going to come up again and how can I prevent it from coming up? So you're never living in the present moment, as we say. So
Right.
people dissociate from their entire experience as a coping mechanism.
Absolutely. Absolutely. And that's something that is seen as well, like with migraine as well.
Yeah.
Like it's more common in migraine than the general population. Even people without vestibular migraine, but just headache kind of migraine.
Yeah. So I always wondered that, like, is there an essence of the aura that people
Hmm.
experience that may be connected to a dissociation piece of it?
Yeah, and it's a nervous system that is very highly sensitive with migraine. So,
So you come along, bring them back into their body, bring them back into their experience, give them a different perspective of what's happening with their thoughts, bring in some mindfulness. And that's where I think it almost becomes transcendent for people because it's like, wow, I've been living this other way for so long, not even realizing what I've been experiencing actually hasn't been what's happening in my present moment. And that's really like you and I can talk about that kind of in a really easy way in 60 seconds.
mhm.
But that can be weeks of or months of practice for people to arrive at that place.
It has to be so titrated because
Mm.
all of this that we've just talked about would totally overwhelm.
Yeah.
Um,
Yeah.
it's very titrated and very and that's I would say that's the biggest challenge for me as well as the biggest frustration is that if I could get people to understand to hang in there long enough, I that's where I have a lot of work to do in helping folks understand that it's a long process. Hang in there.
Yeah. The
Yeah.
journey, I always tell people the journey out is half as long as the journey in typically, but people don't realize how long their journey in happened because they were just unaware of all the symptoms building until they got to the point where their function was so impacted that they had to see someone like a physical therapist.
Yeah, and a lifetime like it's very typical for my clients to say, "Oh yeah, I've had anxiety all my life."
Yeah.
So it's not just the episode, the course of them having dizzy um, sensations and the complex of the vestibular symptoms. It's that whole life journey up to that? And what is their nervous system like when they go into that symptom?
Yeah. I've learned a ton today from you, Sarah. So thank you for joining us today on this episode. Vestibular is not my specialty area, but I'm happy there are people like you out there who specialize in this and are obviously available for the patients and clients that obviously need to find a solution to this. If people want to learn more about you and your work, where can they find out more information about you?
Best thing is just to go to my website, www.dizzycoach.com. I am on social media. I do have a Facebook group. If you all, if there's any people with vestibular issues out there, you're welcome to message me. I have the link to the Facebook group. It's for people with vestibular issues. It's not your standard support group where there's lots of negative talk and fear-based sort of talk. It's very uplifting. I post a challenge every Monday, every week, a healthy lifestyle challenge. And love to have you join and email me. My email is on my website as well. I'm on social media, but not super active posting.
I will grab all those links from Sarah and I'll put them on the blog page at the Integrative Pain Science Institute. So you have access to her website, which is dizzycoach.com, as well as there'll be a link to the Facebook group, and we'll post her email there as well if you want to reach out to Sarah directly. I want to thank Sarah for joining us this week to talk about the overlaps between mental health, dizziness, and pain and anxiety. Make sure to share this episode with your friends, family, and colleague who have an interest in these overlapping areas. Again, I want to thank Sarah for being here. I want to thank all of you for joining me this week. Please stay tuned for next week's episode. Make sure to share this with your friends and family, and we'll see you next week.
Thank you so much.
Thank you for listening to the Pain Science Education Podcast. To subscribe to the podcast and learn more, visit integrativepainscienceinstitute.com. That's integrativepainscienceinstitute.com. Sign up to receive weekly updates and learn about our continuing education courses. If you enjoyed this episode, leave us a review on your favorite podcast platform and share this episode with your friends. Please join us next week as we share more science-backed solutions for treating and reversing chronic and persistent pain.